Hi everyone, it's Kendra Sharp. For this assignment, we were asked to go ahead and teach everyone how to do something. So I figured I'd show everyone how to do a concept map. We do these every day in nursing school. It's the basis of taking care of patients, helping us organize our thoughts, and how to complete a care plan for a patient. So this is a form of brainstorming. It's more likely called mind mapping in our materials that we've been learning. Before this year, actually, we were doing regular care plans. They were horrible. So this just gave us a new concept. Our teacher, actually, we were just having an easy day one day, and we were brainstorming on the big blackboard, and we decided to do a concept map. We loved it, and they integrated it into our education the following year. So anyways, concept mapping 101. So what we're going to do is we're going to start with the central subject. The subject is going to be the patient. Okay. With nursing care plans, we don't so much focus on the main diagnosis, but we come up with nursing diagnosis, which is things that we find that we're going to help the patient to improve on by discharge. So for this patient, we're going to use an example, a 58-year-old male with a spontaneous intracranial bleed. When you walk in the room, what do you see? The patient's in the bed, the patient has a trach, you see picture boards around the room, has a PEG tube, laying in bed. So what is a spontaneous intracranial bleed? It's an accumulation of blood in the intracranial vault. And what are the unknowns in this situation? Something that we as a nurse may not know yet upon walking into that room. Did the patient have a history of hypertension? Was the patient on anticoagulant treatments? So these are things we may be able to find in the chart, or ask the patient if they can't communicate to you, then the family as well. So now we're going to start branching off and going over our different nursing diagnoses that we're going to select for this patient. So to begin, I started with impaired communication. This could be written or verbal communication. What is the evidence that leads us to use this nursing diagnosis? Well, the patient has a trach. When you try to speak to the patient, the patient's communication is very unclear, garbled, he's drooling, and he's unable to grip a pen, so therefore his written communication is impaired as well. He's having trouble with the picture boards in the room. He's having trouble holding his hand up. These are all things that you can put into this bubble here. We have our next nursing diagnosis, which is impaired cerebral tissue perfusion. This is related to the intracranial bleed, as evidenced by the patient had intracranial bleed. They're having trouble forming words. They're unable to walk, and the patient is incontinent. Now, there's several other things we could use, but of course, you could be writing all day long at that point. We have another one here, ineffective coping. So the patient becomes frustrated when you try to communicate with him. He starts trying to yell and get out of his bed. He is in restraints at this point because he is trying to rip the trach out. He's becoming combative. Now, this could be because of the brain damage from the the intracranial bleed, or it could be because he is upset that he cannot communicate with you. He's also trying to remove the restraints. And then we have self-care deficit. The patient has a self-care deficit as evidenced by he's lacking coordination. He's unable to bring his hands to his face. This is something he needs to do to be able to brush his teeth, eat food once he is able, but at this point he has a PEG tube. He's not taking anything by mouth. The patient is unable to bathe himself because he cannot walk, he cannot talk, he cannot, move his arms in a coordinated fashion to be able to do something like that at this time. Now, we can go even further with this and branch off into outer space if we wanted to. Bringing in labs, bringing in the different testing that the patient has had done, imaging, all kinds of stuff like that. We can also branch off of each of these now and go more into our care plan, talking about what are we going to do for this patient? What are our goals for this patient by discharge? What are our goals for this patient by the end of our shift? What are we going to do to maintain these goals? So for, impaired communication, we could say our outcome is by the end of the shift, the patient will be able to point to a picture on the picture board to help communicate. And we will do this by working with the patient, showing him the picture boards, trying to get his strength in his arms, by having him practice pointing to the picture boards. And you can go on and on and on. And then at the end, you want to know, were your goals met? And they're not always going to be met, but this is a way to just put all your thoughts on a paper in an organized fashion, and it really helps you take good care of your patient and just try to look at the whole picture here and not just that one medical diagnosis, because behind that medical diagnosis there's a patient that's just trying to get better. But anyway, this is kind of sharp, and I'm done.